She's a 2, but she's
So my name is Jane Ladlow, and I'm a soft tissue surgeon. So I'm a boarded European diplomat in surgery. I got into this a long time ago. So in about 2002-03, I was looking for a research project, and I operated on a bulldog, and it didn't do quite as well as I'd expected. And I was a bit puzzled because when you read the papers, the dogs all did brilliantly after surgery. It was good to excellent. And then I looked at the papers, and all the papers were owner questionnaires or phoning owners. And it depends very much on what owners then want to believe, and also if they can recognise the clinical signs of BOAS. So then I thought, well, let's design an objective way of looking at the dog's breathing function, and that's how it all started, really. So BOAS is brachycephalic obstructive airway syndrome, and it's a little bit different in the different breeds, but essentially it is restricted or obstructed breathing because of the conformation of the dog.
So guys, we've got
So in different breeds it can vary a little bit. In the French Bulldog it tends to be the nostrils, the nasal cavity, a thickened palate. In the Pug it tends to be a little bit more the nasal cavity and then the larynx and the trachea. And the Bulldog it's nostrils and then palate and then the trachea again, which can be quite tiny. So different breeds have different anatomical lesions, but when you put it together, it affects their breathing, and not just their breathing. So it also causes reflux disease, so they get gastroesophageal reflux, acidity of the esophagus. They also sometimes will have sleep disorders, where they will disturb at night and choke themselves awake, and they overheat in the summer. We came up with a way of measuring respiratory function, which took us about 2 or 3 years, and it was a big chamber called a plesmograph, which is like a pressure chamber. So it's this plastic box, and it has air flowing across it and transducers in the top. And we put the dogs in the chamber, and we could get 20 breaths, and we could measure their respiratory parameters. But we had to get the dogs, and we needed proper normal dogs rather than just clinical dogs that came in with the disease. So we went to the shows, and we collected a lot of data from about 2010 to about 2012-13. And then from that data we could work out what was a reasonable dog and what was an affected dog. And to train the data of the chamber, so we needed an algorithm to train the chamber, and to do that we put our clinical assessment in, and our clinical assessment was based on airway noise and airway effort. And it was before and after a little exercise tested that we could increase our sensitivity of diagnosis. But when we looked at the show dogs, we were seeing dogs that we didn't see in the clinic, and we saw some good breathers. And once you can see your good breathers, then you're safe, because then you've got your control dogs and you can work out your affected dog. I think for the breeders, look at the conformational factors. So we want the thinner heads in all breeds, keep the heads longer and narrower. Yeah, go for the nose, keep the nostrils open. That was our most important conformational risk factor, is to have the open nostrils. And then in the French Bulldog, we like to see a longer neck. In the Bulldog, we want to see a thinner neck. And in the Pug, we want to see a more slender head. In the Pugs particularly, don't let them get fat. So if you get a dog and you can hear it starting to make a bit of noise when it's breathing, and it's an older fat dog, get the weight off, and that will probably improve the breathing a lot in the Pugs. So what we're doing when we're testing the dogs for the RFG scheme is we are listening to them nice and gently with the head in a neutral position before and after an exercise test. We look at their nostril stenosis grades, and then we look at their body condition score. We also register the temperature of the room at the time of the test, and then we are grading them based on the airway noise. So the stertor, which is a low vibratory noise, or the stridor, which is slightly higher pitched, it's like sawing wood. Stertor is more of a... So those are the noises we're listening for, and we listen before and after exercise, because some of the dogs that are really calm before exercise, as soon as you start to increase that air demand, you hear the disease. It doesn't mean we're making a disease, it's just when they're really relaxed and not having to take too much air in, they're fine, but as soon as they have to take a little bit more air in, they see the disease. Okay? So the exercise test, 3 minutes, it's a slow jog, but they do need to jog, and then we listen to them again afterwards. The grading itself is from 0 to 3, so 0, absolutely no evidence of any noise at all, so completely unaffected. The ones have got a little bit of noise, so they've got mild noise, you hear it with a stethoscope, so it doesn't seem to affect quality of life, and it's not linked to clinical signs, so those guys are fine as well. The twos you can hear without the stethoscope, so this is why I think it works, because when a breeder's upset because their dogs are two, well, you can hear it, I can hear it, you hear the dog, what do you want me to do? Because it's, it's obvious, right? And then the threes are a little bit more severe again, so they have obvious problems with their breathing, they've got dyspnea, and they've got severe noise. I was rather surprised when the testing regime became international. So this wasn't really something I ever thought of, and actually the Kennel Club didn't think of it. So when the Norwegians approached us in 2019, I hopped over to Norway to give them a hand, not thinking that that was the start of other countries joining. I think it's been breeder-led. So the breeders have decided how they want to try and improve this disease. Unless you can measure a disease and define the disease, you can't do anything. So even if we get more sophisticated ways of testing for BOAS, which I hope we do, what at least we are doing is defining the disease and coming up with the criteria of measurements, which means that then we can start measuring and going forward.